Okay, welcome, guys. I am very excited to be here with Christa Vino. Yes, close,
Close.
close. say it for real, so we know how you say it.
It's vino,
Vino.
like
Okay,
like the wine, just
so
vino.
first syllable. Okay, and she is going to talk with us about lymphatic taping. So, Christa, why don't you tell us, what you can accomplish with the lymphatic system with tape?
Okay. My name is Christa Vino, and I'm based out of Nova Scotia, Canada, so on the East Coast. And I've been an equine therapist since 1999. And so I went to a 2,200-hour 2-year program. And from there, I specialized into advanced cranial sacral therapy. And then in 2002, I began my lymphatic drainage therapy studies. And so I've always been absolutely fascinated with the lymphatic system, lymphatic therapy, edema, swelling, congestion, you name it. I have always just found it very fascinating. And I truly still believe that this is the therapy of the future, working with the lymphatics, treating conditions where the lymphatic system is compromised, in horses, dogs, sheep, goats, you name it, humans. I truly believe that we are just starting to make big waves in lymphatic therapy. The lymphatic system itself is one of the most understudied system in the body. Even in med school, I think historically it's only been taught for a very short period of time. Now, the new studies coming out and the new curriculum for med school, I think, is changing, which is fantastic. And the same thing with veterinary studies. If I talk too fast, just give me a little wave. I get very excited. I could talk about this for a very long time. And if you guys have any questions, we have allotted it 30 minutes. And seeing as how I have the gift of gab, will have to kind of try to reel me in. But anyway, so the bottom line is I love lymphatics. I love it so much that I actually included it into my logo. You can see here that the lymphatic vessels and the nodes are actually incorporated into my business logo. So where was I going? Oh yes, so taping. So my other love, besides my family and my horses and stuff, is taping. I was the first practitioner trained in Canada to tape horses. I actually had to travel. I was in Florida working on the big circuit there, and Animal Rehab Institute was hosting Dr. Sibyl Mollet, and I was lucky enough to be living 15 minutes away from the first course they offered. And so that was 2013. And so from there, my taping has just blossomed into a major part of my practice. And so because I'm a lymphatic drainage therapist, taping naturally came with it. Taping for lymphatics is invaluable. It is so great, very effective, very easy to apply. But how we used to tape for lymphatics and how we tape for lymphatics now is totally different.
Yeah, let me share
Taping, yeah.
the old way.
Oh, that's excellent, Lisa.
Yeah.
This, for those of you guys watching, this is the first time I've used this particular program, so I'm learning a lot as I go. But yeah, so we know that there are approximately 8,000 lymph nodes in the horse, and the majority of them are, close to the colon, so they're very, very deep into the body cavity. And when we were originally taught to tape for lymphatics, it was this sort of scenario. You can still use this for sure, but what you're trying to do is recruit all of these lymphatic vessels so that you evacuate the fluid out of this leg. However, I deal with very complicated, horses that have had systemic edema. They have chronic progressive lymphedema. They have had, repetitive infections, so they have lymphedema chronically. All of these things where these horses were picked at and had been seen by every veterinarian. They've been bandaged, they've been stall bound, they've had just a lot going on. So when I attempted to do this sort of application, which is, this is a fantastic example and is very well done. But if you have a horse that's really tired and is in a lot of pain and has seen everybody and everything pick at this leg, the chances of them standing very still are slim to none. And what you have to do is you have to actually cut your tape into segments and then wrap down and spiral around.
It takes a lot of
the
practice
leg.
to make it this beautiful.
It does. and
it has to be beautiful, right? But
yeah, we want it to be effective, but this is very good. And then they always, impressed upon you that you should have your spacings even and to recruit more of the lymphatic vessels. And there's not a lot of lymph nodes in the leg. And so what you have to do is you have to kind of get that fluid moving to travel to a lymph node to evacuate through the body. But I'm going to actually use this as an example. Here's a perfect, the orange tape that you see underneath is the strips, the tails, they're called the fantails, are going more diagonal. Whereas you see the red tape, as you get going further down, it becomes more horizontal. And there's a big red flag for somebody that works in lymphatics. And the red horizontal taping, what actually is going to happen, and you'll see this a lot once you become aware of it, it actually forms a tourniquet. Okay, which is what we do not want. We don't want that compression. So the orange tape is very lovely and diagonal and is, encouraging the movement of fluid as opposed to compressing, because what happens with horizontal taping is that it works because you're compressing all those vessels, but as soon as that tape comes off, it's like the floodgates open up again and that fluid rushes back down. So in order to be a little bit more successful, you need to draw the fluid up and out of the leg and not necessarily try to push it. This is another thing. You got me going on a tangent already, but you cannot push fluid through the leg. It has to pull. You have to pull the edema up and out. That's one of the biggest, big misconception. So I hope that comes clear in some of the examples that I'm going to talk about.
Okay.
So here, drainage therapist taping now, and that application, I'm sure, took the therapist a very long time. It's lovely.
I might have lost your. Start again.
Oh, can you hear me?
We're good now.
Okay. So I'm sure that that therapist, it took them a very long time to do that. And so for me, the majority of my referrals, and they have been for many years, are from veterinarians that don't know what to do with these lymphatic cases. So what's something that we can do? That would be an option for sure, but it takes a really long time. And if you get a horse that is, not comfortable with the, fan tapes being wrapped around the leg, you're not going to be successful, unfortunately. So I'm not sure if you guys know, I developed a kinesiology tape of my own, only because what was on the market just didn't work for me as a practitioner. And so I wanted tapes that were stronger adhesives and that they had a specific fabric weave. And I won't get into that today, but one of the tapes that I developed is a hybrid tape. And so it has elastic properties, which you need for any sort of area that's swollen. If you're going to try to work on a leg that has, such a big volume of fluid, you need to have that tape have elastic properties so that it stretches in order to accommodate that fluid volume change as the tape is being effective in working the fluid out of the leg. And so what it also does, it has a very strong adhesive. So once it sticks on, it can stay on long enough to accommodate for that fluid volume change. And you'll see it's called Hesteban lymph. in that when you put it on, if the fluid evacuates really quickly, the tape will pop off because that fluid volume change has happened so fast. There's a whole formula if you really want to get into, treating lymphatic cases about the measurements and how much fluid volume changed out of the limb or whatever, but we're not going to get into that today. But what I can tell you is that when you are taping for lymphatics, if the area is compromised, for example, with some lymphedema cases, the fluid evacuates, or not evacuates, sorry, it actually seeps out of the skin and onto the leg. I've had it so bad, the leg was so swollen that it actually poured out of a little tiny hole. And so you're not going to be able to tape that. But here's the thing. What you can do, it doesn't matter if it's a leg, whether it's an eye, whether it's a shoulder, a knee, the carpals, stifles, you name it. If you can't tape directly on that site, remember you can always tape above it or around it. And I'm going to get Lisa to show up a picture of a stitch on a neck. Okay, so if you see that strip on just where the junction of the scapula and the shoulder meet, that's a great way to open up all those lymphatic vessels. Now, the way you have to think about treating anything that has a compromised lymphatic system, or even a smaller area like this one where the lymphatic vessels have been cut, you need to think of it, and this is one of my most favorite analogies, like a tube of toothpaste. Okay, and this is exactly why lymphatic fluid cannot be pushed out of an area. Okay, if you take a tube of toothpaste and you try to squeeze the toothpaste out with the cap on, that toothpaste will forever remain in that tube. What you need to do to get the toothpaste out is take the cap off. So anything you tape for lymphatics, you can do that first strip down by the scapula, and that'll open up a lot of the vessels and allow the fluid to give it somewhere to go. So for this one, obviously I can't tape directly on the sutures, right? It's fairly new. It's only, I think it was only probably 6 or 7 days when I seen it, but I can tape around it and help direct the lymph back into the lymph nodes. And then what happens with that stagnant fluid, it either gets rerouted to the kidneys and peed out, like urinated out, or it gets recirculated through the body and pumped back again by the heart. Now, there's a whole other, we won't get into the major lymphatic system and what it does in this segment, but just know that that's basically the two options, is that it gets urinated out or it gets pumped and recirculated back through the body. But that's just a really good example of how you could tape around a site. The general rule of thumb when you're taping for lymphatics is that you want to tape so that it gets directed towards the heart. So your primary end for this one would be lower on the neck, right? If you think about that cap of the toothpaste tube and you relate it, I guess, to the horse's body, you see an area of swelling. It doesn't matter how big, how small, whatever. You want to think, how can I release that fluid? Where can I apply my primary end? That's the most important thing. Where can I apply my primary end so that I open up and allow that toothpaste to flow through, or allow that lymphatic fluid to flow through? And so for this one, obviously your primary ends would be attaching to that strip on the lower cervicals. Okay, does that make sense?
A question about why the cross tape in the middle.
Because she had a little bit of swelling, and because when you're a manual lymphatic therapist, you actually are trained to feel where the lymphatic flow goes. Mm-hmm. And so she was actually draining after I did the 2 V strips. She was starting to drain more to the lower part of the neck than actually the first strip that I put on. So I added that one after.
Okay.
Yeah. But could you have done just a straight V? Absolutely. Could I have done A double V, absolutely. Could I have done more tape? For sure. But I have a tendency to tape less first, and then when I reassess, I will either add more or do less. But first and foremost,
is there any point of going higher?
No, there's not at this juncture, because you have to clear all that area below that site. If I taped higher up into the cervicals, where is that congestion going to go? It's going to basically go into where the other edema is, and then you're going to create a blockage. So you always have to think about giving the fluid somewhere to drain into. Could I have taped above that site later on? Yeah, for sure. Absolutely. But again, for me to try to drain the upper cervical area, because you can see there's some edema up in there, would have been counterproductive because the lower segments were not clear. You always have to give a pathway for that stagnant fluid to drain into, right? It's no good to try to evacuate fluid into an area that's already swollen or compromised.
Okay.
So any other questions so far, or am I talking too fast?
Yeah, I haven't seen anything else come in, though. While we're on the neck, we did have an earlier question about draining the area of the jaw, on the underside of the jaw in between the mandibles. I don't know if this...
Okay. Yep.
If you want a different picture, or if...
Okay. So let's first and foremost, I want to go back and still stay on this topic of evacuating into a site. So you want to clear the stagnant area, but in order to clear, say for example, a fetlock, you have to give that fluid somewhere to go. So if you can pull up that picture of, I think I have like really bad start and end. Can you pull up that one for me where it's over the glue,
where the X's and the X's
yeah. Yeah. I'm cramming 25 years of knowledge in here, folks. Bear with me.
Let's see, I think it's this one, yeah. No.
And thank you, whomever Facebook user said you want an orange tape. It might happen. not this year.
And let me show that on the stream. So that's the one.
Okay. Yes. So this was a lymphedema client that actually came to stay on property, and her skin was so compromised because the edema had gotten out of control that the skin was like almost like an alligator skin. It was cracking and breaking open, and so I could not tape that. No way could I ever tape that. So you'll see that I cleared the area above the site. And what that does is it gives that congested area, again, somewhere for that fluid to go into. So the little yellow X's are where I started. That's my primary end, and then ended with the little orange check marks. So that just gives you an example, is that maybe you can't tape exactly on a site because there is, contraindication, or it just won't stick. Maybe you have to bandage, maybe there's whatever reason, but you can always tape. If, for example, this horse was so sore, maybe I wouldn't have been able to even tape on the gluteals. Maybe I would have had to do like over the kidneys. That's always an option, right? You're still increasing circulation.
Okay. I had an earlier question that says, in humans, you need to elevate the limb so it can drain properly. How would you get proper drainage in an animal constantly standing like a horse?
So it's horses are different because their lymph nodes are more into the abdomen. That's why movement is so important if possible with horses. So, and I truly do not believe that elevating a limb that suffers from lymphedema and they need compression garments and stuff like that, I do not believe that gravity actually helps all that much. I really don't. I think you would be more successful wiggling toes in a human, things like that. Total other discussion, but I think having the horse, even if they can walk for a little bit, what that does, that creates movement within the superficial vessels or the lymphatic fluid. Let me backtrack on that too. Okay. So a lot of the lymphatic vessels, not nodes, vessels, are just under the skin. They're superficial. So if you have movement of muscle, you can actually have the lymphedema fluid or evacuate that way through the superficial vessels and not so much through the deep ones. So I would hope that if a person could get a horse moving, it would be more successful. But sometimes that's not an option. Sometimes you need to have them stall bound. It really depends, but I don't believe there's a comparison between elevating a leg and a horse that's stall bound. I think it's I don't know that it really compares.
Thank you. And then another question, what are your thoughts about not adding stretch?
Oh, with not, I rarely use stretch at all. Yeah, at all. Because especially with this tape, because it's tough. It's a tricky tape because it does have a lot of elastic fibers, but the elastic fibers are not for us, right? It's not for us to stretch. It's for us to apply, and then as that fluid evacuates up and out of that area, that tape has to accommodate for that, which is one of the points I had written down. For those of you that know Hesteban, there's 3 different types. Cotton is basically the kinder one to use with any lymphedema case. Satin has very, very little stretch. It was designed, I designed it for like foals, joint stability, anything like that that needed to be very secure. If you use satin with this elastic tape, what you're actually going to do is create that compression effect again. Satin has very little stretch. So you need to use cotton as anchors so that it can accommodate for that fluid volume change. Sometimes when you start taping for lymphedema cases, and it doesn't even have to be lymphedema cases, it can be from like, just an injury or anything like that, but the satin will truly restrict it. So the elastic fibers in the lymphatic tape are not for us. I use 10% stretch maximum, if that, because that's not what it's designed for. You got to let the tape do the work for you. And again, like I said, you want to use cotton as anchors with no stretch. I hope that answers your question.
Yeah, good. Done with this picture, or you want?
Yeah, no, that's fine. Anybody else have any questions on that one so far?
Lives are usually a little bit of a delay, so we might see some questions coming in later, but I can show another image if you want.
Yeah, so it helps. We had a question, I believe, about taping like under the mandible. Mm-hmm. So you can pull that one up of the neck if you want. So this is a really great application for anybody that has, like, how you get the swollen nodes around the jawline, TMJ issues, eye issues, any of that. The most important thing that you want to think about is, again, where is my primary end going to be? So, and I did put a video up on my professional Facebook page. So it's like Christa Vino, International Equine Therapist, and that will show you a ton of different lymphatic applications. But so for anything like under the mandible, again, not necessarily do you have to tape exactly on this spot. With the area here, there's so many lymph nodes. And what happens in chronic cases or cases where the lymph nodes have been working over time or have had a series of issues with the immune system. For example, maybe they had a reaction to vaccines, and then maybe they're allergic to something in the hay, mold or dust, and then so they've had a history of chronic problems, and those lymph nodes stay full. What happens is that those little lymph nodes, they're like little kidneys, and they filter all that fluid. When they become overtaxed, they can actually have some fibrosing and scarring in there. And so any sort of thing, you don't necessarily have to tape right directly over that lymph node. And the same thing under the mandibles. You can try for sure, but your main goal has to be, where can I tape? Where can I apply the tape so that I will clear out an area and give that primary, or the affected site somewhere to release that fluid to give them a pathway to drain into. So my primary end for this horse, or any sort of TMJ problems, you can do eyes around, like actually around the orbit, would be lower on the neck. And again, your goal is to clear that area so that the congestion can be rerouted through there. Does that make sense? I hope that makes sense.
Makes sense to me.
Okay, good.
I was taught that there's almost a suction that gets set up. So when you start draining proximally, it will actually pull from more distal areas.
It's like an osmotic pressure. You're right. Yeah. Absolutely. Yeah, absolutely. For sure. Because, you know, fluid volume moves from a pressure of like, what is it, a high gradient to a low gradient, or low gradient to high gradient, something like that, right? It's no different. Another example I always use is that if you have a piece of paper towel laying by your sink and there's a drop of water on it, if the two connect, right, that drop of water is going to go from that wet surface into the dry. And so what we're doing with the tape is that we're creating that drier environment, for lack of better terms, and giving that fluid somewhere to go. Yeah, for sure. It's all about pressure. And you know, like you had explained it as a suction, for sure. Yeah. So one other taping that I'd like to show you is a little bit different than what we were just talking about. And this is for sinus drainage. And if you could pull up the little gray horse.
Let's see. Did I have that one? I had a face. Oh yeah.
Yeah.
Yeah. So this is tiny. Let me see if I can blow it up a little.
Oh, okay. Yeah.
Oh, let's show it on stream. Yeah, that helps.
There you go. So I'm going to tell you a story, and this application can be as complicated or as simple as this. It can be for dental issues, sinus issues, but are we necessarily going to be able to have our primary end up high? Are the lymphatics going to drain that way? Probably not as easy. So this would be kind of an exception to the rule, where your primary end would be on the nostrils, especially for sinuses. And what that does, it actually will, I wish I had sent you the other picture, because the discharge coming out of her was crazy. Yeah, it was really just so much. And she had suffered for quite a long time with allergies, and just nasally and congested and stuff like that. But so that would be just one of the very rare exceptions to the rule, where you'd want to tape a little distally first. So an example of can you pull up the 3-segmented picture before we? I'm going to try really hard to stay on time, but this is probably not going to happen.
That's all right. I'm okay. If you're okay with going over, I am okay with going over.
Yeah.
And then there was one other question about sheath taping.
Oh, yes. Okay.
Let's see if I can find a leg. That's the one.
Okay.
There we go.
So this was my prototype. Some of you have probably seen this before. So I had been working with the different types of adhesive, the different fabrics and stuff like that. Whoever asked the orange question, I did have a pink, and I'm not sure if you and I had talked about that before, but I did make it in pink at one time. So this was an older gentleman, and he had chronic edema, like just stagnant fluid in that fetlock forever, for years and years. And I was like, hey, you know what? I work at this barn all the time. Can I try this new tape? I put it on, and I went to work on other horses and came back in an hour and took the tape off, not really knowing what to expect. And that's what happened in 1 hour. There was no real rhyme or reason to my application. I just thought, hey, you know what? Let's just try it and see what happens. And this was probably the case that made me really go from the exploration phase to the prototype phase to what I have now. Just a huge difference. And that was 1 hour. And pretty crazy, hey? Mm-hmm. And the thing is that he never swelled up again. You know, with a certain amount of adhesive, you know, you're gonna be, anytime you put tape on, you're gonna have that fascial response, right? So if lymphatic fluid cannot pass through tight fascia, and scar tissue. So obviously this guy having a chronic edema problem, the fascia was probably involved at some point. Can we show the back photo? So the one thing about this lymphatic tape is it's very shocking. You tapers are using it like just incredibly with different conditions and things I would have never thought about because I'm stuck in the lymphatic therapist brain. But this is actually after a kissing spine surgery, and he had it's on the east coast of Canada. We're just catching up with veterinary techniques. Our veterinarians are really doing a good job of having more diagnostic skills. So we're just starting here KS surgeries, and so this was one where he was having accumulation of pockets of edema along the incision site. And so once he was healed and we had the veterinarian give us the okay, we taped him for this, and it was amazing, the results. Like, just absolutely shocking. I didn't really know how well he would come, but don't just think about lymphatic tape just for swelling. It can be for just generally increasing circulation. So one of the questions I was asked are why the holes? Why? And the thing is that, so we know lymphatic vessels have valves. And, a primary example would be that big, the photo of the leg that I showed you with the yellow stars and the check marks. That lymphatic vessels have valves. And so the reason why this tape works so well is that those holes create little channels that mimic the natural lymphatic valves and the pathways. And so don't just think that you can use this for that. A lot of tapers just use it if, before an event, because it helps, relax the muscles, it increases circulation, things like that. So that's just one of the kissing spines taping that we did. And then if you can show the V taping, and this is the one that I do for swollen sheaths.
So what body part was that on?
You'll see it like around the flank. It's like a kind of
yeah, got it.
Yeah, it should be the. There we go. So this again was the prototype for what's now called Esteban lymph, and this horse, he's lovely. I've known him forever, and he developed a swollen sheath. Now, oftentimes the sheath area is really, really tricky to work on. It's kind of greasy. It's, nothing really, no matter how much you wipe it off with your towel, the tape is very difficult to adhere to. But if we look at the lymphatic system and we see how it runs, this again, we're going to try to navigate all that fluid into the main lymphatic nodes. So you're going to have to kind of go, so for those that don't, really study lymphatics as much as I psychotically do, go back, have a look at your anatomy texts and figure out exactly where those pathways go. So for a sheath, this is the one that I found that is the most successful. Now, you can definitely do over the kidneys as well. You can do the glutes, but what you're trying to do is recruit all that fluid into the main lymphatic channel. So you're aiming for that fluid to go a little deeper into the abdomen, into the deeper lymphatic channels. And so could you also do a hamstring taping? Absolutely. Could you do even more like up higher around the glutes and lumbar spine? Absolutely. The one thing that I will tell you is that the reason why I stopped there through the middle of the horse is because there's something called a watershed. Mm-hmm. The lymphatic vessels will drain into this area, so around his inguinals, and then there's another channel that will drain into more the axilla, and so you want to direct it so your primary ends are going to be a little bit closer together right at the top of that stifle and flank area.
Okay, so you're starting low and then going up toward.
Yep.
Okay.
Yep. Again, because you're trying to recruit all those lymphatic vessels, right? And trying to give that fluid somewhere to go. And your main goal for this one is, again, to try to tape close to the nearest aggregate of lymph nodes.
All right. Awesome. So I think that question was from Angie, so I hope that helped you, Angie. And then we have, let's see, we have a question about using it for dogs.
I have a ton of dog pictures. I don't know if I can send that to Lisa now. So I don't advertise this a lot, but when I first graduated, I worked with a vet clinic and treated about 25 dogs a week. And it's something that I still do now, but I just don't advertise. I tape dogs all the time. And if you want to, look at my Facebook pictures, there's a lot of canine photos on there. And if there's something that you are unsure of how to tape, just send me a message and maybe we can brainstorm and think about it. But yeah, absolutely, this works great for dogs for sure. This lymph tape has the same adhesive as satin. Cotton is different. And so you kind of have to play with the texture of the dog hair, what works best for them, whether it's the cotton adhesive or the other two. So it just really all depends on the dog. I've had some canine tapers that only use satin and some use a combination of both. It really just all depends.
Yeah, for me, it's all in their fur. Seal fur is really different than a herding dog fur, and certain tapes stick better. And sometimes I'm just, let's try this one, and next week we'll do it different if it doesn't stay long. And it just all depends.
Yeah, the only thing with dogs, and the same thing with horses, is that I just ask that you tell the owners for them to be supervised. And the same thing when I tape a horse, if I think they're going to be in a paddock together with a bunch of other horses that are going to be picking at the tape, that you either separate them or have a fly sheet or something over top of them, just to make sure that everybody's safe. That's all.
Yeah, the one dog that I have that has edema, I can't tape because he's a tape eater.
Right. Yep. And that's exactly it. And
some lymph drainage. That's that.
Yeah, and that's a topic for another discussion for sure. Is when do we not tape? That's a huge discussion that we don't talk enough about. Yeah.
Yeah, we should do that sometime. Another question for the sheath: would you do this taping that you did on the hip and the flank on both sides?
Yes, you could do it bilaterally. Yep. So and this is another one talking about, I'm not an over taper. Okay. And this is partially how Hestiband started to come out into the public. Because I put up this post and I'm like, is over taping becoming a problem? And I think it is. I think in our industry, we need to take a deep breath in and go, wow, this is really exciting. It looks really cool. It works fabulous. But what are my principles of rehab? What are my main goals today as a therapist? So this horse, I only taped unilaterally, one-sided. That picture that you've seen, just that side. If a horse, say for example, when I showed you that big lymphatic, the compromised leg where the skin was peeling open, her lymphatic system and her immune system and her body as a whole would never have tolerated me taping her bilaterally. With lymphatics, you have to be so careful that you don't overload their system, right? That's another massive discussion. So can you tape bilaterally? Yes. Should you? That really depends on the case you're working on that day. Have they been sick for a long time? Are they compromised? Have they been on medication? Just so many things that you have to think about as a therapist. So can you? Yes. Should you? Really depends on the case.
But you might not need to, just doing it unilaterally would be enough.
Yeah.
Done, right.
Yep. And he was only swollen on one side. Right.
Okay.
And maybe the next time you go back, you don't do this taping, you do over the kidneys. Right. And I want, Lisa and I were talking earlier, and I'll just finish up with this, I guess, is that, really we're all here for one goal, and that's to help the animals that we work on, or the person with the elevated leg. Maybe you're a human therapist. But don't ever feel that you can't reach out and ask questions. 25 years ago when I started, there was no other therapists, nobody. And now I've talked to Lisa for 3 years, I think, almost. And if I don't have an answer, or maybe Lisa doesn't have an answer, let's try to find and connect with somebody. And that's the beauty about the internet now, that, you know, maybe I don't have the answer, but certainly let's try to find out for you guys. So like, just keep the community happy and healthy and focused on rehab, and, you know, reach out if you need to.